So my name is Heather Patterson, and I'm an emergency physician, and I'm a photographer. I am doing a documentary photography project telling the authentic story about what it looks like to be part of the pandemic response in our Calgary hospitals. I'm documenting both clinical work and non-clinical work, and I also have the privilege of telling the stories of patients and families. Did you hear Trauma Bay 1? I chose to be a doctor because I love people. I love their stories. I love the privilege of interacting with them in any capacity. And I think it brings a richness to life for me that nothing else could. I became a photographer because I love capturing humanity. The little moments, the real moments, the big and crazy moments, but the opportunity to share with people and create a piece of art that demonstrates who we are and how we act in all different circumstances is something that is very important to me. So as an emergency physician, my role is entirely different than that of a photographer. So when I'm standing at the foot of the bed leading a resuscitation, it is my job to have clear leadership, good decision making, and clarity of thought. And in order to do that, I actually have to acknowledge, this is for me, but I acknowledge what I'm feeling. I acknowledge the tragedy that I'm witnessing in front of me, and then I set it aside, and I experience it and debrief it later. When I'm a photographer at the foot of the bed in a resuscitation, I'm actively looking for the humanity of the situation. How are we caring for that patient above and beyond our medical care to ensure that they understand that we are their people in that moment? We are the ones who are holding their hands, communicating with them, sharing moments of humanity together. And so rather than taking those emotional moments and setting them aside, I'm experiencing them as they happen. And I think that is a unique thing as a physician. We don't have that same opportunity. It really allows me to reflect on the privilege that we have to care for the people in front of us. When I was thinking about this project, I was inspired watching the people around me. And I wanted people to be able to see the way I saw my colleagues. I wanted them to see the dedication, the hard work, and the commitment that they had towards caring for the community. The teamwork and the collaboration is very different than perhaps the way we were siloed previously. Everybody's willing to help and looking for ways to contribute. And that to me is incredible to see people going above and beyond. So we were just in a level 1 trauma. We had a patient come in from a car accident, and what I was noticing was the way that people were interacting together. So we had several nurses, we had a physician, we had another resident, and you'll notice the communication, the eye contact, you'll notice the way the physician had his hand on the patient's foot, providing some comfort. Those are the moments that I really like to highlight. For this project, my hope and my dream is that the people who see it feel inspired, and they inspired to feel some optimism despite a very challenging circumstance. We all come from different backgrounds. We all experience COVID in different ways. But by demonstrating that the real humanity of what we're experiencing, my hope is that people come away seeing the best of things in a challenging circumstance.